We are going to study this particular context, and these are the things that we just learned. This cranial bones divided into two parts: neurocranium, viscerocranium, covering this particular brain and covering this face region. It has a space in between. We call them as diploic space between the outer table and the inner table of this particular bone. It has a covering. We call them as periosteum. The cranial bone related to this particular aspects have got different sources, origin. We learned about it, and you have to know the names of it. Now, whenever you are going to study this particular bones, you have to know these particular views. We call them as Norma. So, based on how you are looking at this particular views on the bone, you just like a name it. Norma verticalis. You look at this particular bones, that particular joints, they are facing in this particular region, and the important salient clinical features or clinical important regions to it. So, Norma basalis, Norma verticalis, Norma frontalis, and the bones which are present to it, the foramens, if they are visible in these particular parts, that what you have to learn. So, this is what we have already discussed in so many times. Norma lateralis, individual bones as well we have learned here. Only the salient features or the parts of the bone will be tested in examination. Do not expect that without giving right answer to pass in an examination. This exams is going to be difficult, and you have to just like show up with some kind of like a study you have made during this particular like preparation phase. So, you have to learn this particular anatomy related to this particular salient features of the cranial bones. We learned about this particular union, Pterion, to mention over here, which is an union point between these particular bones, which is joining over here frontal bone and this sphenoid bone and this parietal bone and this particular bone which is present in, we call them as temporal bone. So, these particular bones makes a union. At this particular point, we have a vascular structure running due to it. This is the weakest part of the skull region. If it is fractured, we have an injury to this meningeal vessel that can lead to damage to this particular vessel if you have a depressed kind of fracture, leading to extradural hematoma. Now, other than this particular normal lateralis, which has got like the zygomatic bone, zygomatic arch, and it has a line which is called them as like a superior temporal line, inferior temporal line. So, these and this particular opening we already learned mastoid fossae, external acromices, these are visible, and this particular region have got fossas. So, we call them as temporal fossa, infratemporal fossa based on how they are there, and Pterygopalatine fossa, which is a deeply placed fossa that is present. Temporal fossa, which is upper side of this particular region there, we call this as a temporalis muscle with the covering cover to it. Deep to that, under to it, if you remove the zygomatic bone, we have this particular space continued from this particular temporal fossa, we call them as infratemporal fossa. And then from this particular infratemporal fossa, we get a deep placed fossa between this maxilla and the palate and the sphenoid bone, we call them as Pterygopalatine fossa. So, you should have an idea about this particular lateral fossas. The lateral fossas are kind of like not been tested in examination yet, but could have an exam question like this particular fossa which is present on the lateral views. There are three fossas are there, and they can ask as a exam questions like three fossas and the presence of this particular fossas in terms of like structures and these boundaries which is present or making this particular region and the content which is lying to it. So, you can prepare that for exam short notes or a kind of like a fragmented short notes. Norma occipitalis, this is a posterior side view of the skull which has got like sutures and as well as the bone we learned about, and this is Norma basalis. We learned about so many times about this particular Norma basalis, and this particular Norma basalis have got two views. These are the external view or view from the lower part, and there is a cut section view. We call them as Norma basalis on the cut region, and this particular cut region exposes this particular cranial fossa, and that particular cranial fossa exposes this particular foramens which are present to it, and through here we have some neural structure going through and the non-neural structure also passing through. So, these are the base of the skull from two extremes that we have to learn. Now, from this particular Norma basalis, as we have seen this particular region, this particular Norma basalis holds this particular the interior of the skull into three parts of it. So, we call these parts as the cranial base or cranial fossas. So, we have this particular cranial fossa, three of them: anterior cranial fossa, anterior to this lesser wing, then we have the middle cranial fossa in between, and posterior cranial fossa by the greater wing. This is different colors been used, and each of these particular fossas are kind of like having this particular foramens, and they have a boundary as well. So, you have to know this particular what do you mean by the cranial fossa, how many of them, how they are like grossly divided into, and what are the different kinds of like a cavity, foramens and the neural structure that is running through. The middle part of this part over here, we have this particular hypophyseal space, where this particular area there within this particular body of the sphenoid bone, we call them a sella turcica, which having this kind of cavity, we call them a sella turcic cavity, tuberculum sella, anterior limit, and dorsum sella, posterior limit. In between them, we have this hypophyseal fossa, this particular saddle shaped gap there. So, this is about this particular fossas that is present anterior, middle and the posterior cranial fossas, and the neural structure that is passing through these particular foramens, and neural and non-neural structure that we have learned in previous classes as well about what are the foramen that is transmitting. We have to identify the foramen given in examination. You have to identify this particular on your own. Maybe the examiner may ask you to just like identify this particular foramen and what structure passes through this particular wire passing, or they may just like pass the wire and ask about the foramen and tell about what the structure contain going. It can be coming as exam OSPE as well. Coming to this particular point is the developmental or early age skull. We have this particular gap present in this particular skull. We call them as Fontanelles. Out of these particular Fontanelles, they are present in these vertical aspects and the lateral aspects. There are 4 or in a side there are 1, 2, 3, 4 and 5, 6 Fontanelles are there or gaps are there. Out of that, this most remarkable is anterior and posterior cranial Fontanelles. So, this particular Fontanelles which is exposing to these bregma and the lambda, and this particular Fontanelles which closes by the normal age like 1 to 1.5 year to 2 years anterior one, and this one is a little bit earlier than this particular age, which is closing by the 6 months of age. So, this particular Fontanelles is kind of like a bony gap, bony deficiency present in the skull as we are born with, and the clinical presence or clinical significance is concerned to it, we have to know. Coming to this particular bones related to the neck region, we have this particular bone which is atlas and axis. They are making this particular joint, atlanto-axial joint and atlanto-occipital joint. So, these particular joints are prone to have fractures if it is fracturing by this particular trauma or hanging or etc., etc. There are different types of fractures are there. We call them as Jefferson fractures, hangman's fracture, etc., etc. Where we have this particular C1 and C2 may be fractured, along with that ligaments which is attached to it may have got torn and leading to some clinical problems related to it. So, to summarize these things about this particular skull region, you have to know about this particular base of the skull and the foramens and the cranial fossas, how these particular cranial fossas are there, which is divided in, and a rare or kind of like a difficult question if it is given, this lateral fossa may be given. 3 of these lateral fossas are there in the Norma lateralis, and they ask about this particular Norma lateralis and tell about this particular spaces which is present to it. So, this is about this quick recap of this particular bones in the skull region. Individually, you have to know this particular frontal bone and this, and as well as this occipital bone and parietal bone, and as well as this particular temporal bone. You have to know the basic parts of it which are related to it. That's we have mentioned in this classes most of the time. The foramens, of course, they are very important, and relevant like bone which is related to the neck and head region is the mandible. You have to know the mandible in and out along with these particular vertebrae, that you have to know these particular different parts of the vertebra, what makes different from this particular vertebra from cervical part to this lumbar part, and special vertebra in this region C1 and C2, and what kind of joint they are making with this particular corresponding bones, and small bones in the face, we do not give it like palatine bones or ethmoid bones, we usually do not give it in examinations. So, this is what all we have. Before exam, I will just introduce the sphenoid for a brief exposure, like wings of the sphenoid, body of the sphenoid, and the Pterygopalatine plates. There are 2 of them are there. So, we will briefly expose that before exam only. I will do that because it is a little bit complicated. So, before exam, so once this like everything is over, I will introduce that part. So, this is what is meant for you to understand, meant for you to learn about. So, you have to know about this particular content and this particular areas. Any doubt, any queries in the bone and osteology? Any questions? No questions. Good. That means you are ready for exam. So, write down exam question. Write a short note of 3-mark questions with a clinical explanation, 2 of them. Anterior fontanelle, what is anterior fontanelle and the clinical use or clinical significance of it. 3-mark question, 2 plus 1, 2 for anterior fontanelle describing it and 1 for the clinical use of this anterior fontanelle. This is number 1. Number 2 is Pterion and the clinical role or clinical significance of Pterion. 3-mark question, 2 plus 1. These are the 2 short questions that is present. Then you just write out styloid process, 2 marks. The muscles and the ligaments or the attachments and the relationship of the styloid process. So, that is a 2 mark. That means you have to explain what is a styloid process, which is linked to the which bone, and the relationship of the styloid process, that you have to mention that ligaments, muscles and the neural and non-neural relationship of this styloid process. 2 mark question. This is question number 3. And question number 4, what is superior orbital fissure, SOF, structure passing through SOF or structures passing through SOF, superior orbital fissure, 2 mark. So, that means you have to make sure that you mention that what is SOF, in which bone SOF is seen and it transmitting what neural and non-neural structures, that is 2 marks. So, 3 plus 3, 2 plus 2, 10-mark question. You have 15 minutes time. Clinical role, 1 plus 3 plus 2 plus 1. Then question number 2 is Pterion, 2 plus 1, clinical significance. Number 3 is styloid process and the attachments or relationship or anatomy of styloid process, which means you have to mention that relationship of the structures and attachments to it. And last one, superior orbital fissure and the structure passing through superior orbital fissures. That means you have to mention about this foramen, where you are going to see this particular foramen and what content is present or passing through that particular region.